Hello learners, welcome to lecture series on applied ethics. Today we are going to discuss the second lecture on the concept of abortion and ethical concerns related to it. We had a discussion on abortion and philosophical perspectives. Here, abortion, as you know, is a topic that has sparked significant ethical debates across societies and cultures. So, today we are going to dwell into complex ethical issues surrounding abortions. In our previous lecture on the abortion philosophical perspectives, we have already looked at different philosophical frameworks which give rise to different moral concerns related to this concept of abortion. Today we'll be focusing more on real time practical examples. So ethical concerns in abortion actually affect real lives, influence legal systems, and touch deeply on cultural, social, and personal values. So, just to have a recap of what abortion is, abortion means termination of pregnancy, and especially that of a human fetus. So, in medical history, there are several cases where the fetuses are not viable and may die, but not with someone's assistance. Here we are concerned with those cases where a consensus decision is taken to undergo abortion. So in bioethics, the pressing debate revolves around the issue whether it is ethical or unethical to indulge in such an act of taking away the life of, if fetus does have a life, taking away the life of someone. So an ethical position that surrounds this issue is to perceive life as a sacred in itself. So those who support abortion provide pro-choice arguments in favor of the women's rights to choose. The emphasis is on the autonomy and personal rights of the women. On the other hand, those who believe that abortion is inherently immoral and are against its application at any stage of pregnancy are pro-life groups. So we already had a look on these two types, pro-choice and pro-life groups in our previous lecture. So the main contesting issue is with regard to the moral status of the unborn fetus and to consider whether the unborn fetus has the right to life or not. We have already explored these questions related to personhood and moral agency of fetus in our lecture on abortion philosophical perspectives. Now it is essential to understand abortion beyond theoretical debates because it intersects with practical realities faced by individual, families, healthcare providers, and policymakers. So alongside the right of the life of fetus, there are various other markers that question the ethical standing of the act of abortion. So, such as concern for the welfare of the child, especially in the cases of unwanted pregnancies or cases when child will be born with severe disorders. There are also concern for the life and autonomy of the mother. There are concern for the future of the society. And then there are social, religious, legal connects that have some impacts on the decision of abortion. So as we go through this lecture, we'll explore these different dimensions in a structured and comprehensive way. Let us start with the effects on individuals, families, communities, and healthcare providers. So these decisions often come with complex real-world implications that go beyond a simple yes or no about the abortion. So, talking about the individuals, for individuals, deciding whether or not to have an abortion involves considering not only personal beliefs but also economic realities. The question is not just limited to women's autonomy and right on their own body, but also includes other social, economical impacts of the unwanted pregnancy. The economic implications of the unwanted pregnancies, such as the cost of raising the child and potential disruptions to education or employment, can significantly impact people's lives. So, social acceptance of child born as a result of out of wed relations or due to rape, etc., also raises ethical concerns. If we talk about the impact on families and communities, these decisions influence relationships, support systems, and social dynamics. The question of whether to terminate a pregnancy extend beyond the individual, making the choice affecting partners, parents, and sometimes entire communities. And we talk about the other people who could have some impact of the decision of abortion are healthcare providers. They also face ethical dilemmas when performing abortion. One of the primary challenges is balancing patient's autonomy, the right of the patient to make decision about their own body, with the healthcare provider's personal beliefs or institutional policy. So there could be, conflict between what a healthcare provider believes in or what healthcare institution policy says and what is the demand of the patient. Now, there are also, some mental health impact of the process of abortion. So the post-abortion care is very much required. So the emotional and psychological impacts of abortion on women are significant ethical concerns. The emotional and psychological effects of abortion vary widely from person to person. Many women experience a sense of relief after an abortion when pregnancy is unwanted, particularly if they felt that it was the best decision for the particular situation. However, others may experience a mix of emotions, including guilt, sadness, or anxiety, because they might feel that they have taken away life, they have killed, unborn life. So there are also some long-term psychological effects, though these vary greatly depending on individual circumstances. For some, negative feelings may persist and they may experience what is often referred to as post-abortion stress. This can include feelings of regret, depression, or even symptoms of PTSD in some cases. It's important to note that research suggests that mental health outcomes are generally better when women feel supported in their decisions and have access to adequate counseling before and after the procedure. So healthcare providers have an ethical obligation to offer psychological support and counseling services post-abortion. Additionally, social stigma surrounding abortion can exacerbate mental health issues. It may be that, someone taunt about or, mention the same thing again and again. So it might lead to some kind of isolation in the mind of the mother and some form of shame. Then there is another, where the important ethical concern associated with abortion is informed consent and coercion. So women must be fully informed about the procedure, its risk, and alternatives before making a decision. because abortion not only carries potential psychological, emotional effect, but it also have a physical risk, as happens with many other medical procedures. So physical complications may include infection, excessive bleeding, or injury to the uterus. So these risks are more pronounced in unsafe abortion settings, where procedures are carried out without proper medical supervision. Sterile equipments are not used, or in environments where medical help is not readily available. So women who belong to the lower strata, or maybe to the rural areas where medical facilities are not available, they face these kind of challenges more. So informed consent is a critical ethical principle that must be upheld in all medical procedures, and abortion is no exception. So ensuring patient safety also involves providing access to high quality healthcare, safe facilities, and competent medical professionals. So an ethical concern arises when women face coercion, being pressured into abortion by partners, family members, or because of societal expectation. This happened majorly because when women get pregnant, when she is unmarried, or there might be a case where it has been determined that women has a female fetus. So based on this sex determination and gender discrimination, if she is forced to carry out the abortion. Respecting a woman's reproductive autonomy means ensuring she can make informed, voluntary decisions about her health without undue pressure. Now, there are some legal and social connects associated with the act of abortion. Let us first talk about the legal status. Abortion laws vary significantly across the world. It's not that abortion is legalized in all the countries. In some countries, abortion is legal and widely accessible, while in others, it is highly restricted or completely banned. For instance, countries like Canada and Netherlands allow unrestricted access to abortion, while others such as Poland or Salvador have significant legal restrictions. In some places, abortion is only allowed if the mother's life is in danger, while other countries have exceptions for cases like rape, incest, or fetal abnormalities. India legalized abortion through medical termination of pregnancy, which is also known as MTP Act of 1971, which allows women to terminate pregnancies under specific conditions. So in India, it is allowed in a restricted manner. So these varying legal statuses have profound ethical implications. Restrictive laws can limit women's rights to make decisions about their own bodies, impacting their autonomy and access to healthcare. When abortion is heavily restricted, women may be forced to seek unsafe illegal procedures, which can put their health and lives at risk. So the ethical challenge is to strike a balance between protecting potential life and respecting women's autonomy and rights to health and safety. So you can see that there is a philosophical framework of the right of the women on their own body, autonomy of the women, and right of the life of the fetus. But if we look at the practical implication, real life scenarios, what are the laws of the country, they have the impact on those frameworks, okay, whether they are in a position to use their autonomy or not. So there needs to be, consideration about the appropriate laws in the society. Now, if we talk about the public policy and advocacy, abortion legalization is the key area where ethical concern play a major role. Policies that either restrict or allow access to abortion services are often rooted in differing ethical perspectives on value of the fetal life and the rights of the women. Restrictive policies may aim to protect what is viewed as the unborn child's right to life, but they also raise ethical concern about the right of the women to control their bodies and make decisions about their reproductive health. So I've already pointed out that how these philosophical frameworks are important. So the government's role in personal health decision is a contentious issue. That what is the role of the government? What is the law of the? What is the role of the legislature in such kind of situation? Should the state have the authority to limit a woman's access to abortion, or should it prioritize individual rights and freedoms? This question is at the heart of the debate on abortion policy and involves balancing competing ethical values, protection of potential life versus respect for personal autonomy and human rights. Now, there are some advocacy groups that play a crucial role in shaping public opinion and influencing abortion policy. On the one side, there are pro-choice groups like Planned Parenthood and NARAL Pro-Choice America, which advocates for women's right to access safe and legal abortion services. They argue that restricting abortion violates women's right to make decisions about their own bodies and health. On the other side, there are pro-life groups like the National Right to Life Committee and other similar organizations argue for the right of the unborn, emphasizing that life begins at the conception and abortion is morally equivalent to taking a life. So these groups, advocacy groups, often push for policies that restrict access to abortion based on their ethical position regarding the sanctity of life. So understanding the ethical positions of these advocacy groups helps us to appreciate the complexities involved in shaping public policy. So making a public policy is an on-ground thing, and these pro-life and pro-choice frameworks are philosophical discussions. So, looking at the legal side or legal connects with this act of abortion, let us look at the social attitudes and stigmas associated with this. The legal context of abortion is closely linked to social attitudes and stigma. Social perceptions of abortion can be polarized, often divided between pro-choice and pro-life stances. Stigma associated with abortion can have severe consequences for women seeking the procedure, as well as for the healthcare providers involved in performing abortions. Women who seek abortion may face judgment from their families, communities, or even medical professionals, which can increase emotional distress and deter them from seeking needed care. Similarly, healthcare provider may face professional and personal stigma, which can impact their willingness to provide abortion services. So understanding both legal and social context helps us grasp the broader ethical concerns that surround abortion, particularly in terms of rights, stigma, and access to care. Now let us look at some of the cultural and religious influences. These also play a significant role in shaping people's perspective on abortion. Let us first talk about the cultural perspectives. Cultural views on abortion can vary significantly. So there could be two different sort of cultures, collectivist culture or individualist culture. Talking about the collectivist culture, there the community's well-being often takes precedence over individual autonomy. In these cultures, decision about abortion may be influenced not only by the individual's needs, but also by the family and societal expectation. Women may face pressure from family members, which can either discourage or encourage abortion based on cultural beliefs. Conversely, in individualistic cultures, the emphasis is often on the personal autonomy and the right to make decision about one's own body. In these societies, abortion is often viewed as a personal decision that should be made by the woman herself without external pressure. The cultural norms and tradition that shape attitude towards abortion must be taken into consideration. Now let us talk about the religious perspective. Religious perspectives also plays a critical role in shaping ethical viewpoints on abortion. Many religious traditions have strong position on abortion, often viewing it as morally wrong. So if we talk about the Christianity, within the Catholic Church, abortion is largely opposed to on the grounds that life begins at the conception, and therefore terminating a pregnancy is equivalent to taking a life. And if we talk about the Buddhism, while generally they value life of the all forms of life, they may allow abortion on consideration of the individual's intent and circumstances. If we talk about the Hinduism traditionally places great emphasis on the sanctity of life. And many Hindu texts explicitly condemn abortion, viewing it as an act of violence, himsa, against a sentient being. However, Hindu ethics also stress the importance of intent and context, allowing for flexibility in cases where the mother's life is in danger. So Hinduism cyclical view of life and karma, cyclical view of life that, one, after the death, one born again. So it goes in a cycle, death and birth goes in a cycle. And karma plays an important role. These concepts introduce a deeper understanding of the life and death, which leads to diverse interpretations across different communities. Now, there are some, looking at the legal, social, cultural, and religious connects and impacts on abortion, let us look at the ethical implication of abortion technology. So, the advancement of technology has led to several ethical concerns for the bioethicist. Now, this advancement in medical technology have significant ethical implication for abortion also. As fetal viability improves, questions arises about the morality of late-term abortions. Technologies like ultrasound allow parents to see detailed images of the fetus impacting their decision. So what if they get to know that, the fetus have some defects. So the child who will be born will not be a normal child, but with certain, defects. So these advancements compel us to consider the emotional and ethical impact technology has on decisions about terminating pregnancies. So let us first talk about the selective abortion and gender discrimination, which could be the result of this technological advancement in the field of medicine, because using sonography and other means, one can determine the sex of the fetus. So selective abortion, particularly based on gender, raise significant ethical issues. In many cultures, there is a strong preference for male children, leading to gender-based selective abortions. So this practice perpetuates gender inequality and reinforces harmful stereotypes about the value of female life. While ethical debates must consider a woman's right to choose, they must also address how laws can combat gender discrimination. So you know that in India, gender gender determination is illegal. The nursing homes, gynecologists cannot determine the gender of sex of the fetus. So here we need to make a balance while respecting the individual choices. Now let us talk about the abortion in cases of fetal abnormalities, where it is determined beforehand, before the child is born, that child will be born with certain kind of defects. So there are ethical considerations which become more complex in these particular cases where fetal abnormalities are diagnosed. So late-term abortion may be considered when serious fetal abnormalities are detected. So this raises ethical questions about whether aborting a fetus due to disability discriminate against individual with disabilities. Do we need perfect human being, or we accept the differences in the society? So there exists a tension between respecting parental autonomy in making difficult decisions and the ethical judgment society places on the values of disabled lives. Now, after looking at the several ethical concerns related to the act of abortion, let us look at 3 different case studies from real life. First, let us take the case of Savita. This case is from the year 2012. Savita was 31-year-old dentist, tragically died in Ireland due to complications during pregnancy. Savita was actually 17 weeks pregnant when she began experiencing a miscarriage. Despite her request for an abortion to prevent infection, the medical team refused to perform the procedure, citing Irish laws, which at that time severely restricted abortion access. So the medical team argued that as long as there was a detectable fetal heartbeat, they could not legally terminate the pregnancy. And unfortunately, Savita's condition deteriorated and she died from septicemia. So this case drew widespread attention and highlighted the ethical implications of restrictive abortion laws. It brought to the forefront issues of women's rights, patients' autonomy, and the ethical autonomy of healthcare providers. So the ethical question raised include, should the law prioritize the life of the fetus over the health and life of the mother? Did the healthcare team fail to provide adequate care due to restrictive legal frameworks? So Savita's death led to significant public outrage and eventually contributed to the legal changes in Ireland, leading to some flexibility in country's strict abortion laws. Now let us look at the second real-time case. It's a case of 10-year-old rape survivor. It's a story of 10-year-old girl from Ohio, USA, who became pregnant after being raped. So due to Ohio's restrictive abortion laws, which prohibit abortion after 6 weeks, because she was a small kid, she had no understanding. So by the time her family got to know about this, they saw the visible changes in her body, these weeks were passed. So this young girl had to travel to Indiana to obtain an abortion. So the ethical dilemma here are manifolded, balancing the rights of a minor child who is also a victim of sexual assault, the psychological and physical consequences of forcing a young girl to carry a pregnancy to term, and ethical appropriateness of rigid abortion restriction that do not take individual circumstances into account. So this case highlights how restrictive abortion laws can create deeply distressing and potentially harmful situation, particularly for vulnerable population such as minors and victims of sexual violence. Now let us look at another case, which is from the Argentina's journey to legalizing abortion. So in Argentina, abortion was legalized in December 2020. So it's a very recent phenomena. So there was a long struggle by women rights activists for this legalization. Before legalization, many women in Argentina resorted to unsafe clandestine abortion due to restrictive laws, leading to a high number of preventable maternal deaths. So it's not that if abortion is not legalized, it will not happen. It will still happen because of some of the social stigmas in rape cases or in case of unwanted pregnancies. So it's better to have these strong laws to think about the betterment of the health of the mother's health. So activists argued that access to safe and legal abortion is a fundamental human right and a matter of public health, while opponents viewed it as morally unacceptable. So the ethical debate in Argentina revolved around whether the government should prioritize the safety and autonomy of women or adhere to conservative views on protecting unborn life. So this case demonstrates how activism and advocacy can influence public policy and how deeply ingrained cultural and religious values can impact the legal status of abortion. So this was it about this lecture on ethical concerns related to abortion. So I hope with these two lectures, philosophical perspectives on abortion and ethical concerns related to abortion, you have gained the deeper insight related to this concept. There is a list of references related to this topic, so you can go through them. Thank you everyone for joining for today's lecture. Thank you.